medicine that has more applications.
Correct. With a lot of different things, from cancer to anti-aging. So it's a really wide spectrum.
So can you tell me about what exactly it is?
Sure. So there's a couple of definitions, but technically hyperbaric literally means high pressure. And the way that I look at it is if you are adding atmospheric pressure to where the patient is and their entire atmosphere. So if a patient is sitting here, if they're in an enclosure that can create more atmospheric pressure than what is currently around them, so greater than, it's actually the opposite of like sea level to altitude. It's like going underwater, like scuba diving. So that's why it's important for divers. But so medically, if you're using it that way, that's really what it is if you're adding additional atmospheres of pressure to the patient and thus their breathing gas. So the air that we're breathing, like right now, is at sea level. We're in a sea level city. If we were to add an atmosphere, it would be to the gas that we're breathing.
Okay, so then when that happens, what are the biological effects beneficial?
Very good question. So it really goes to the very smallest working organisms in our body, cells, microbes, things like that. Cells process a lot, the mitochondria function a lot based on oxygen and how much oxygen they have. So that's why the greater atmospheres are so helpful, is because of those additional atmospheric levels that you're adding, you increase the partial pressure of oxygen. So that means your mitochondria gets more oxygen. So if you have any sort of mitochondrial dysfunction, this can help to kind of course correct.
Okay, so mitochondria are tiny little organisms. They're really organisms, really, but organelles in your cells that are like the motor that your body runs on as far as making the energy packets out of oxygen and sugar in order to fuel your body. Correct. And so a lot of people have mitochondria that don't work very well, and you can have chronic fatigue from that and other,
And it really compounds, like if you have something, like this morning in the conference, they're talking about Lyme disease. Maybe not even that, but something just like you've got some sort of viral infection. If you have mitochondrial dysfunction, it just compounds that, and then you can't get better from the infection.
Right, because energy is needed for the immune system to be able to work effectively. And that's why you get tired when you get sick.
Exactly.
Right? So what happens is we're kind of supercharging the blood with oxygen.
Exactly.
Right? And then that also pushes oxygen more into cells so they can work it better.
Exactly.
Okay, so this is used a lot for also head injuries.
Yes.
And so we see, like I see a lot of working with professional athletes, I see a lot of acute head injuries, but then you can also see PTSD and other things. So can you tell me a little bit about, the brain uses like 30 to 35% of the oxygen in the body, I think, at any time. 30, 35, 40, we'll just make a general recommendation.
It's somewhere in there.
Somewhere in there. And so the brain is really highly metabolic. And so that's why this can be so good for neurological issues.
Absolutely.
So can you tell me a little bit about what sort of protocols you'd see with that, or how you treat that?
Yes. Our clinic is a little bit different in the way that we go about that, because our patients are so far out on the bell curve. They are nowhere near the middle. So we don't do a lot of standard protocols. There are standard protocols that I think they work really well, usually for things like head injuries, stuff like that, that has to do with the head. There's a lot of 20 to 40 treatments between 2 and 2.5 atmospheres, 100% oxygen. Either there's different ways that they dose the oxygen. So it could be 10 minutes on, 5 minutes off. It's somewhere between a minute on and 25 minutes on, and a minute off and 5 minutes off. The reason that they do that is so that patients don't get oxygen toxicity. That's a real thing that can happen. However, I can say I've not actually seen oxygen toxicity since 2007, when I learned about all this in somebody that wasn't doing it for a dive-related injury. So, you want to be careful, but oxygen is really good. And usually the fact that they're doing the hyperbarics for some sort of cellular oxygen deficit says a lot that they are probably not going to get toxic.
Right. Right. Because they need it.
Right. But yeah, 20 to 40 sessions. Some people need more than that. I mean, frankly, a lot of people don't get to 40 sessions because it's a lot for patients. Compliance is a big thing, and it's not the treatment, it's that they have lives, and it's taking 2 hours out of your day every single day for however long you can do that.
So you need to do it days in a row, or is that how it works best?
So that's one of the things that we work with people on, because we really want them to be successful in their treatment. So we don't do days in a row. For some people, it's a good idea. If your physician recommends it, it's because you need it. But it's not always realistic. So what we do typically is 1 to 3 days a week, whatever they can work in. And that way it stretches out the time that they're going to be doing it, but it really also increases success with their healing, which is really what we want. That's the goal. And we also so here's the other thing, is that a lot of folks really believe that deeper is better as far as the pressures. That's not necessarily the case. And some people will even say that anything below 2 atmospheres doesn't do anything. And that's just not true at all. For some of our patients, especially folks that have a lot of cellular dysfunction, a lot of genetic SNPs, mutations, things like that, they really can only tolerate so much at a time, because it really does get the cells working very, very fast. And so what that means is then they have a lot of dumping from their cells of toxic elements. And so they have big detox reactions. So we want to make sure that that's great and wonderful, and we want to keep it going, but it needs to be tolerable for the patient, really. So sometimes starting lower with pressure, with a little bit less oxygen, additional oxygen, I should say, is actually, that works better for some of our folks. But like I said, there are people that are nowhere near the bell curve. They're so far out there, you don't know where they are on the line.
Right. Dr. Anderson really does pull a lot of complicated cases, because no one else can really handle it.
Yes.
Right.
We get a lot of folks, and the referral says, I just don't know what to do from here. Great. Send them in.
Right. So if someone was going to do a hyperbaric therapy, it's about 2 hours long.
It really depends. So we go anywhere from a 45-minute treatment. And so for us, what we define the treatment time as is time at pressure, at the treatment pressure.
Okay.
So like, say we're going to start somebody out who's real sensitive. We know they're going to have some detox. We want to start them out, and we'll do a low pressure, 1.3 atmospheres. I know with our chamber, that's going to take 6 minutes at least to get there. For them, it might take 10.
Is this the soft one you're talking about?
Okay. Yeah, the soft one. Well, yes, but
I'd like to talk about the
hard pressure, or the hard side chamber, also does 1.3. So it could be in either one, but it could be 45 minutes to 2 hours, but it also takes time to get there, and it takes time to decompress. So we don't count the pressurization and decompression towards treatment time. That's just sort of inert
that makes
time.
Sense.
Yeah.
That makes sense. So does it take longer for the soft side to blow up than the hard? Or
it actually takes a lot longer to get to pressure at the hard side chamber, especially if you're going to a deep depth. Okay. And the reason is that it's just a much larger vessel, and the compressor it only goes so fast. So hard side chamber takes a little longer to pressurize.
And so the hard side can also go a lot deeper.
Correct.
What's the range that it can go to?
Technically, right now it is set to 2.2 atmospheres. We can alter it, and I guess we wouldn't alter it. The company that manufactures it, would come in and bring in different valves and make it go deeper, but we haven't done that. However, I can say that this chamber, if you took away the valves that we have now and just looked at it as a piece of hardware, is exactly what they use in commercial diving. And those chambers go really, really deep. Like, they can go to 6-7 atmospheres.
Okay.
So
now the different pressures can treat different problems, correct?
Yes, correct. So so that's another thing that we do a little bit outside of the norm. We're still on, right?
I think so, yes.
Okay. Just want to make sure. So there are standard depths for different sorts of ailments. So like for brain injuries, it's typically at least 1.5 atmospheres and deeper. And then, like, say for cancer, usually the research is usually done between also 1.5 and 2.5 atmospheres. There might be some at 3, some research at 3 atmospheres. There's some research at 1.75. There's some at 1 atmospheres. So what we do though is we really try and find the sweet spot for the patient. Where are they getting benefit? What depth is it? So we rotate through and kind of see what happens. And for some people, it's 1.5 atmospheres and they're doing really, really well. For other people, it's 2.2, and some people just kind of roll steady at 1.3, which I think is really interesting.
Yeah, everybody's so different.
Yeah.
Right?
Exactly.
So it's interesting. So if someone came and got therapies and they could use like 20 to 40, about how much do they usually run each?
The treatments?
Yes.
Cost-wise? So at our clinic, it's $175 for an hour and $200 for 90 minutes. And that's regardless of pressure or chamber. It doesn't matter. So that's how we do that. Some people that do less time, we do adjust it for a lesser treatment time. And then some folks actually do more than a 90-minute treatment. They'll do a full 2 hours in the chamber. And usually that's something we talk about later, but that's a little bit more just for the time.
And so as far as improvements that people would see so that they would know how, they were reacting. Can you talk a little bit about those?
Sure. Yep. So that's an interesting one because it can be very different between people, even people with the same ailments, I guess. But one thing that starts to happen is the sleep cycle starts to regulate itself. That being said, it doesn't happen instantly. There are some people that say I went home and I had the best night's sleep of my life. That happens sometimes, but that's more the exception than the rule. But generally after, I'd say 4 or 5 treatments, they start to get better sleep and they sleep longer. Some other things are, like we talked about, the detox reaction. So those can be kind of icky, but it's also a really good sign that your cells are kind of jumping in and
what are signs of that, just for people?
Yeah, so rashes, headache, going to the bathroom more. A big one with patients is just a lot more urination. And it'll actually happen, that can start while they're in the chamber. And hyperbarics also interacts with the cells in your kidneys pretty quickly, and the cells just start correcting what they're doing very fast. So then people have to go to the bathroom, and a lot of people just chalk it up to, oh, I'm stuck in this, I can't get out without your help, so I have to go to the bathroom, and I think I have to go to the bathroom, but I probably don't. Nope, that's very real. You really do have to pee really, really bad. I know it's only been 25 minutes, but your kidneys are dumping something.
Does it change the filtration rate? Or
I think so.
Interesting.
Yes. Exactly. So there's that. And then so like I said, it's used for anti-aging. So people's skin, so like rashes with detox, but also if they're not somebody that's detoxing and they're doing it for, some other thing, and say they're pretty clean system, their skin starts looking really good. It actually, so there's stem cell facials, you compare it with hyperbarics to help your body really accept the they're your stem cells anyway, but really accept them and get them to do what you want them to do. The other thing, so this is sort of, I'm veering off here, but at 2 atmospheres and greater is what they say, people start to regenerate more of their own stem cells. So that's another thing that happens. So if you're going to do a stem cell facial, I think it's really good to go and do, 2 to 10 treatments at least 1.75 or deeper atmospheres, and then you're going to have a lot of stem cells for your facial.
I love those facials.
Yes.
You do them. I might have had a couple.
I had one. Yeah. I want one. But anyway,
there's other ways that you can also increase stem cells too, like vitamin D and chlorella are a couple of good ones. But the HBOT can certainly be. Yep. I'm sure it does it a little bit more. Which brings me to one of the things that I find the most fascinating with it, and that is the fact that there are epigenetic changes that happen from the pressure. So you can would you talk about that, please?
I can, but not as well as I would like to. So here's the thing.
We'll tag team this.
Okay, yes.
Dr. Anderson's not here.
Exactly. Yeah, where is that guy? So here's the thing is that oxygen helps your body to signal the expression of your genes, and they are seeing that in research. But what they will tell you is that we don't know what genes are signaled, and we don't know at what depth they're signaled, but they know that at different depths different genes are signaled. And it is thought that it typically is it's what your body really should be doing. So say you have a SNP that says, oh, I'm not going to convert this form of vitamin A to the form that you can use it in. Well, theoretically, if you're doing hyperbarics and say you're doing it, twice a week, every week for the next 6 months or whatever, if you rotate through different depths, chances are you're going to hit the depth that helps the vitamin A SNP. And the other thing too is that we don't know that. So say you're at 1.75, and that just theoretically that's where the vitamin A SNP is affected. Well, you don't know that it's not affected at 2.2, but it's very nebulous. It's out there somewhere, and they just don't know yet, but they know that it tends to be signaling things in favor of the body working correctly and functioning better. So it's really how things should be signaling, but for some reason are not.
I remember because we were at a neurological conference this last spring, and one of the presenters there, I think he said there's something like 150 different SNPs that are impacted.
Mm-hmm. There's probably more.
Right.
There's probably a lot more. They just don't know what they are yet.
Right.
And yeah, that's kind of that's been what I've learned so far.
It is a frontier of medicine.
It really is. Yes. If any of you are curious about these things, Dr. Paul Harch has been researching for decades. He's in the Louisiana area. And a lot of it has to do, it started out for him with crush injuries and went to brain injuries and all these other things. And so a wealth of knowledge. He's got some websites. All of his research is out there. There's a lot of folks though that are doing really amazing research with it.
Yeah. So as far as crush injuries and then neurological problems, cancer, anti-aging, is there anything that this would not be good for?
Yes, there are. So first of all, you can't get in it if you've had a recent pneumothorax where your lung is collapsed. You're not at risk for getting one going in, but it could actually recollapse your lung. There are some contraindications. So if you're first trimester pregnant, don't want to get in. Second trimester and on, it's actually really good and helpful. It can shut down preterm labor. It helps with cardiac stress. I think both in the pregnant mom and if the baby has some sort of heart stress or distress. Let's see, emphysema, because there's O2 and CO2 signaling, which actually you would think it would be great for them because they're getting more oxygen, but then they're getting more oxygen. It tells the brain, we've got oxygen, we don't need to breathe. So there's some of that stuff. So emphysema, COPD, and of course there's always outliers where possibly there's something where it would be okay for them, and I only say that because we tend to see those people. Let's see. Who else would it not? I'm not sure. Other than that, it's really a matter of as long as your lungs are in good working order, and you're not going to have some huge cascade of either detox or die-off. Usually it's not going to be a true die-off reaction. It's really going to be more of a detox, but it does kill anaerobic bacteria and gram-negative. So there's that also. So if you have somebody with C. diff, the chamber is one of the best things for them.
I was going to be curious about that. Does it help with GI issues? Because so many people have GI problems.
Yep.
But it would be affecting the microbes.
Exactly.
Specifically.
It's really the microbes. Part of it is repairing just the lining of the intestine and all of that. But then there's a lot of microbes in there, and a lot of them are friends and some of them are not. So it really should be killing the stuff that we don't want. You want to make sure if you're doing it for GI stuff, even if you're not, it's really good to make sure that you're kind of maintaining your GI with a good probiotic and enzymes. I mean, don't forget the enzymes. The seeds need the soil, so you got to keep that up. But we've had patients that were going in for, cancer or something like that. They're not going in for cancer. It's usually to heal up a radiation burn or something like that.
Oh, I see.
Yeah, so things like that, radiation burns. We've had patients who've done a lot of chemo in the past. They're trying to clean up their system post cancer.
It's so toxic.
Yeah, chemo is heavily, heavily toxic. And then come to find out later, they'll say, "Oh, I've had diarrhea for weeks. I don't know why they didn't tell me this beforehand." But
especially going into a chamber.
And this has happened a couple times. Anyway, but then they'll come back a week later. My diarrhea is gone. Oh, well, excellent. think you should have told me you had it in the first place, but great, it's gone now. That's good.
That's neat.
Yeah.
So with cancer, because Dr. Anderson just wrote or co-wrote the Outside the Box Cancer Therapies book, and he does talk about hyperbaric there. I believe that he says it helps shunt not only oxygen, but also nutrients into cells for repair.
Yes.
And that's why you can give them with IVs at the same time. Can you talk to me a little bit about that?
So we do a lot of that. So it does. It helps the cell to more readily open up and accept what has been put into the system through an IV. We do a lot of IVs that are either high dose vitamin C, or they're just building. They're just good for the system in the process of, dealing with cancer. It's things like vitamins, minerals, other nutrients like that these folks are very likely, if not sure, to be completely depleted of. So it helps their cells to, one, just open up. The membranes become more permeable. It allows things in, which the permeability is also why you have the detox reaction.
Because it allows things out.
Exactly. So it allows things that should be out. And so we do IVs either before or after. There's some that we prefer to do before versus after, or the other way around. One of those, and this one is a little bit, people are on both sides of the fence of this one. We prefer to do the hyperbaric previous to the high dose vitamin C, as opposed to doing it after. We don't want folks to have nerve and muscle pain and things like that, which can happen with high dose C if you're doing a high dose or high pressure of hyperbarics. So we do hyperbarics after vitamin C, but it's just at a lesser pressure. And by lesser, I mean somewhere between 1.3, 1.5, maybe 1.75 if the patient's done that pressure before. But yeah, we don't want to drive them into pain with their treatment. There's really no reason for that.
That's probably a good plan.
Although some people are on the other side and they want to drive the fentanyl reaction. And if you're a doctor listening and that's your thing, great, keep doing it. Just our patients don't really want to be in pain. So that's what that's all about.
So what about for pain? Does it help with pain?
It depends on the pain and what it's caused by. It helps with nerve pain greatly. We've seen people have, so one patient was in a car accident, had nerve pain. The accident wasn't terribly severe, so we weren't really sure why the nerve pain was happening from the accident. But she also was a chronic infectious patient, so we're not sure what was going on there. Really bad nerve pain. She declined pain meds from the hospital for a couple of reasons, but she went in the chamber. She's one of those ones that did longer than 90 minutes. She did 2 full hours. She was totally passed out in there, and when she came out, she didn't have any more nerve pain. So that was kind of amazing. Not every case is like that.
That's a good case.
Yeah, it's a pretty good one. But other folks, like for instance with MS, so with them there's the whole neurological picture, and with them it can really help with pain and functionality. They can start to kind of get the function back of like your fingers and hands, toes, things like that. And it also helps the pain. But also with things like TBI, it can help with the headaches. It can help with all those other symptoms that are kind of hard to treat, but that's what is being treated really with TBIs, if you're looking conventionally, is just the symptoms. And it can really help with that, both pain, brain fog, all that kind of stuff.
So there's a lot of like vascular restriction or sluggish blood flow in muscles, etc., with pain. So do you see it improve circulation that way?
It's really interesting because it does improve circulation, but it does it after the treatment. So when you're actually in there's a lot of vasoconstriction, which is interesting. So, and to be quite honest, I don't know that whole picture terribly well, but what I'm guessing is happening is your body is actually getting the blood and hyperoxygenating all of it. And so it's not you're not getting a lot of periphery vasodilation while you're in there, but then later you do. So it's sort of like the blood is all sequestered for a little bit to get all the oxygen, and then you've got a lot of oxygen both in the blood but also in the tissues during the treatment. And then the high levels of oxygen in the tissues actually stays, they think, and again, this is something that they really don't know, but they think it actually hyperoxygenates the tissues in your whole body, including the brain, everywhere, for up to 3 hours, I think. So if you're getting an IV directly after, you've still got all that going on. But it's more than just that. After, even though the blood is hyperoxygenated, including the tissues for a couple of hours, you've also got the cells actually doing what they're supposed to be doing. So you've already kind of started the cells to figure out what's going on. Then you give them more of what they need, and they do even more. So they're very synergistic, IVs and hyperbaric.
Do you do anything else with the hyperbaric really frequently?
One thing that we do quite a bit is the keto diet for many different reasons. But for instance, brain injuries, the brain, while it really, really likes glucose, it also can function really well on ketones and actually is more apt to repair itself on a fat adapted ketogenic diet. And so we do a lot of the keto diet with it. And actually for our patients, regardless of why they're seeing us, if they are doing the keto diet and they're actually tracking like ketones and glucose and all that, we tell them that they don't have to do hyperbaric and IV treatment on the same day. They can come in on different days if that makes, the whole scheduling easier. And for some people it really does, because the keto diet will kind of tie it all together and you don't need to do it right back to back. But I always think it's good to kind of keep those together if you can.
Yeah. Because keto is so good for cancer.
Yes.
As well as
the
neurological brain issues, because the ketogenic diet by itself has been looked at for improving seizures, etc. Do you use it on seizure?
We have,
seizure patients?
We don't have any folks with seizure activity currently, but we have for the past, actually, they all just kind of, anyway.
Did they get better?
Some of them got better. One of them was a young adult, and he sort of, he left the nest.
It happens.
Yeah, good for him. And one of them, he's a patient, but he is on the east side, the northeast side of Canada. So we see him sometimes, not all the time. And so that's kind of how most of those specific cases are going, but we do a lot of it with them, actually.
So you also do like light therapy.
We do.
Do you do that with HBOT as well? Do you do it inside the...
So that's a really good question.
I want to know more about this.
Okay, so we do, it's a laser that is intravenous, which I think is just the coolest thing ever. Usually we do that simultaneously with the IV because it's intravenous, and we have these IV catheters that can do both. It can do an IV plus the laser at the same time. And we do it exactly the same. We keep the IV protocol going, add in the laser, and then do the hyperbarics with it. And for infectious folks, it's a huge game changer to tie those three things together. And in one of the chambers, we have a light pad. And this light pad, I think, is pretty amazing. Forget if the patient with the car accident and the nerve pain, I don't remember if she used the light pad or not. I would have to look. But the light pad is just this little pad, and it's, like $1 million, but it's worth it. And it's red and infrared light diodes. So what it's marketed as is pain relief. However, I have folks put it over their liver, or if there's, if they have something with their spleen, we'll put it over the spleen. And it actually really seems to make a difference for folks that, like, say they have a handicapped liver and their liver doesn't get rid of stuff like it should. You put them in the chamber with that thing, and it really does kind of help the liver do what it's supposed to. And it's not like a really heavy hammer. It's pretty gentle, actually.
So is it like the cold laser red light? And so there's research about that cold laser, that it's giving like photon packets into the cells in the mitochondria to help use that energy better. So it could certainly go hand in hand, because you're feeding the mitochondria with both.
Exactly. And the other thing too is, then if we're doing the laser, which is in the bloodstream, blood is going right by it and picking up all the photons, and there's different colors. So that it's thought that different colors have different wavelengths, and so each wavelength does its own thing for your body. Can
you tell me more? I know it's a little bit out of topic, but the IV laser.
Yes.
It might not be your specialty, but
it's
can you
not.
tell me a little?
I
Do you know anything about it to talk about it?
I wish Dr. Shane was here because he's excellent at explaining this. So I really feel like I don't know near enough to be able to say anything about it. But so there's different colors. There's red, yellow, green, blue, and ultraviolet. Ultraviolet is really good for, well, they're all good for infectious folks, but ultraviolet and red, there's a lot of research on.
Right. Because they've been using ultraviolet light, even if they take the blood out. So do you take the blood out?
So we do both.
Okay.
So sometimes we take the blood out, we ozonate it and run it through a special machine that has UV light. And then there's the other one where we just have the laser that goes in, and there's an actual fiber optic that's inside your vein. And like if you have, say, a power port or a PIC, we have to actually access one of your peripheral veins. It can't go through those.
It had to do it right.
Exactly. Yeah. So there's actually a fiber optic that is connected to an ultraviolet light, and so that's in your system. And so if you have, an infection that's in your blood, it's not going to be able to live through ultraviolet light. It's just not. That being said, it's not going to get all of it with one IV. It's going to take a few. It's going to be a few times, and with that, you're certainly going to get some die-off, which one you kind of want. You want to know what you're doing is working. Right. But again, there's the whole, how bad is your die-off reaction? Are you able to go to work next week? We see patients where they may realistically not be able to go to work for about a week. Right. So we got to be careful. We got to make sure we're doing it safely and all that. And the doctors at the clinic they're all about safety. But so there's a lot of research on, and most of it is European, of course, which is great. But most of it's on red laser and UV laser, and with many different viral infections, bacterial infections. I have heard, I don't know if it's true, but I've heard that Ebola does not like the ozone. And so it makes me wonder, because so ozone is O3 instead of O2. And so it makes me wonder, with the whole Ebola thing a little while back, if we didn't have some UV and ozone, if a lot of people could have been better.
Because when you put ozone, when you do like major autologous chemotherapy, right? And that's where you take out blood and then put ozone into it. The blood turns bright red because it's hyperoxygenated.
Yep.
So that would be similar to the HBOT in a way.
And we actually do those together. We do ozone together with hyperbaric. And that's usually for either folks with some sort of cancer and they have some sort of infection. There's actually a lot more of that out there than I think people realize. And if you have cancer, I would say
some cancers are associated with viral cancer.
Exactly.
Viral infections.
Exactly. And so, or we have folks, like just everybody else in the world that has like really nasty infections, and we'll do those two things together. And that can really kind of drive some stuff right on out of your system, because that's a not good place for a pathogen.
Right. We're at a complex chronic infection conference in Portland right now. And so we're talking a lot about infections and how, some people are symptomatic when they have infections and some aren't.
Some people are not.
Which is interesting, right? Because you already talked about the soil, right? Like you have to make sure that soil is healthy, which is like the cells of the body, so that you can grow good things rather than
exactly. Because if it's all toxic or just filled up with pathogens and other stuff that you don't know is there, it's not going to do anything for you.
So this is really good for detoxification.
Yes.
Like you said, even though you have to be careful because you don't want to have Herxheimer reactions.
And really most people won't.
Right.
But like I said, we see the folks that have the reaction that shouldn't be happening.
And what we're seeing now actually in like my own practice, and I'm sure advanced medical therapies as well, is that things are becoming more and more and more complicated for the average person. And I think that it has something to do with not only the toxicity in the environment, but also the stress that we're under. And so more and more people are going to be more complex cases. The days when you could just be like, oh, take a B vitamin and you'll be fine, are long gone.
That's long gone.
They're long gone.
Oh my.
Yeah. And so that's why we want all of these different therapies, and we want to be on the cutting edge and the frontier of science-based medicine as far as what can help, and make logical decisions about what is going to be best for patients to build them up rather than just like give antibiotics or give, cortisone or whatever it is. So HBOT can be very detoxifying, which is awesome because that's the root of all evil, I think.
Yeah.
It's really also probably stress relieving in some ways because you're in this pod and no one can bother you.
Nobody can bother you. You can't really do very much in there because you really shouldn't have electronics in there. That's a controversial topic, but we'll leave that alone for now.
Well, the hard tank, could you even get a signal in it?
That's a good question. You probably could. So in that one, there's these windows, or portholes, if you will, but they're made out of Lexan, which is like a really strong, like plastic or acrylic kind of thing. So maybe you could, but really, it's best just leave that stuff out there. Let the treatment be relaxing. Let it be a good excuse to unplug for an hour, hour and a half, 2 hours, whatever. And you're probably going to sleep in there anyway.
Right. So that's one of the things that they've talked about a little bit here as far as the mental emotional piece of disease. It's a big piece. It's the biggest. Well,
it's a huge piece that's oftentimes ignored, especially by patients, I find. Not to shame any patients, but you can do all this work to help clean up your body, but if you don't get rid of the toxic relationships or the stress at work or whatever it is,
even being married to your disease.
Exactly. That's a huge thing. People that are like, they're stuck to it. They don't want to let go of this thing that's made them who they are in their eyes for a long time.
And you have to let it go if you're going to get better.
And you have to let it go. You have to have things in your life that you do that are not treatment related. You have to do things with other people that have nothing to do with you being the center of whatever it is. So that's very important.
So as far as because at the Bad Girls Guide to Living Well is for people to be able to, not live a perfect life.
Right.
Because there's no such thing.
There's no such thing.
And yet be able to enjoy health for the most part. So it's like, if you want to, not eat 100% organically, like these are the supplements, or if you want to not avoid gluten every now and then, this is the supplementation. And so how good is HBOT for hangovers?
Oh, it's let me tell you what. Okay. Not from actually not from personal experience, but that's one of the first things I learned in dive school, believe it or not, was divers have been using hyperbarics and oxygen for hangovers since they've had hyperbaric chambers and oxygen to use.
It's like firemen and banana bags in Vegas.
Exactly.
I don't have personal experience with that.
None. And it works amazingly well. I actually think one day I was getting carbon monoxide. There was some stuff going on the back of a boat, and I was the only one there. And I started to have some bizarre, I started to lose energy. I was like, something's wrong. I'm all by myself and I can't think and I can hardly walk. So I just walked over to the chamber, just started breathing the oxygen I couldn't put myself in the chamber and do a treatment, but I honestly think it actually saved my life one time. So yes. And yes, hangovers. It's excellent for hangovers. It's really good just to kind of, like I said, it's an anti-aging. So that's not just superficial. That's with all of your tissues. So if you want to be a little bit naughty sometimes, it can really help you recover from that.
We both like to be naughty sometimes.
Sometimes.
So I have a question though, because, and forgive my ignorance. Now, a lot of aging is oxidative stress.
Yes. So this is an interesting paradox.
Okay.
Where, and I don't know that I really have an answer, but but I can tell you what I know, which isn't a lot. So hyperbarics actually does drive an oxidative burst in your system, which is why we pair it with things like high dose vitamin C.
Because that can kill cancer cells.
Exactly. So but it does start some sort of oxygen related cycle, if you will, in your system. And so I'm not sure where the oxidative burst is driving healing and where it's, because it is a giant anti-aging thing. And so I don't know, to be quite honest, but there's a paradox.
There's a lot that's not known about physiology, actually. So
I think it's sort of like
probably more mitochondrial.
Yeah.
Right?
I mean, I would imagine.
So how about anti-inflammatory? Is it anti-inflammatory?
It helps folks with inflammation quite a bit.
Do you know why?
I think it helps the system to get rid of stuff that it wasn't.
The toxicity.
Yeah, it's almost like your body just sort of either forgot or didn't have the tools to be able to flush what it wants to flush. And so as soon as you give it the oxygen, it's able to actually do what it was supposed to be doing the whole time and couldn't.
I mean, the kidneys themselves being upregulated is huge because the kidneys,
giant thing.
Dr. Anderson has something that I like to say and steal about different organs. He's got his own Chinese medicine theory. This is one of my favorite things. So looking at like eldest child, middle child, youngest child, right? So he's like, the eldest child's the liver, like they're resilient, they can go out there, you know, like they're always gonna like just be able to tackle just about anything, right? And so then the middle children are the lungs and the kidneys, where they're just totally just kind of like taken for granted. They, you know, aren't paid a whole lot of attention to, but they're delicate. And once you like have trouble with your lungs, like emphysema or, you know, like
once they're
damaged, there's not a whole hell of a lot you can do, right? And so it's like the kidneys, like they just work in the lungs, they just work so hard, doing all of this stuff behind the scenes. And then the youngest child is like the heart and the colon, where if any little thing goes wrong, they get all the attention, right?
Yes.
And so like the kidneys
really
as the middle children.
I didn't know he had that.
Oh, it's good.
Wow.
And so the kidneys are so incredibly delicate, and we see things like I've talked about this before, on every single bottle of antiperspirant that you look at in the store, and I have been OCD enough to go through and look at the back of every single label. It will say, consult your doctor before using if you have chronic kidney disease. Oh my God, which means that there's something in high enough amounts in that you're absorbing through your skin in high enough amounts.
For them to be able to put it on there?
Right.
Wow.
I mean, it's just cover their ass, right? But
but that means there's something there to be covered.
Of course. And so then it's something that can come up to high enough amounts that it can cause damage if you have chronic kidney disease. And now most kidney labs don't even look. I mean, once you look at the estimated GFR, which is the most common thing, like most labs will just say over 60, which is still about stage 2 kidney disease.
Right.
And so you're already having kidney issues at that point. So HBOT being able to upregulate kidney function is huge in and of itself, because there's not a whole lot that can be helpful for the kidneys.
Exactly.
And if you're over the age of 50, you probably have chronic kidney disease. So take home here, don't use antiperspirants.
I don't.
Use me neither. We smell great.
Yeah.
You can use deodorants, or also like there's antibiotic, crystals and things that you can use, because it's not really your smell that's smelling, but that's besides the point.
Yeah, exactly.
So with like anti-aging, because I'm going to be anti-aging AF, from now until the end of time, because
I'm into it.
Right?
Yeah.
Because that's how we stay healthy. That's how we have quality of life.
Exactly.
So for anti-aging, how often would you recommend doing an HBOT treatment?
That's a good question. What I would say is, it depends on where you're starting from, but I would say maybe do a little bit of front loading and do a few weeks of 2 to 3 times a week. See how you're doing with it. Maybe you have more detox than you thought to do, or whatever. But then you could back off and do, after you get the front loading done and you kind of get your system in good working order, back off, do once a week for a while, and then maybe once every other week, and come in more often if you need to. Like, say you're out at a conference and you're drinking a lot that weekend or whatever, maybe go back and do 2 that week and then back off a little bit more. Just kind of gauge where you're at. One of the things for an anti-aging is different than doing like treatment stuff. So with anti-aging, I would say spread it out, do it when you need it, especially if you have something stressful, physically, emotional, whatever. Go and do a little bit more around that, and then you can back off and do it less. For other stuff, for when we're doing like treatment-wise with chronic infectious folks or whoever, we do it more as a pulse therapy. So we do it kind of intense 1 to 3 times a week for these folks, depending on what we're doing it for anywhere from 6 weeks to 6 months, and then back off, give it a break, let your body take over, because at that, you don't want to keep fixing something.
Right. The body will adapt.
The body will adapt. It'll figure it out. It'll kind of pick up where your treatment leaves off. And there's a little bit of a dance there with how much does one person need to really get the system rolling in the right direction. But then once your body has that, let it do its thing, and you can back off and not do it again for 6 months, a year, depending on how well you're doing, maybe 2 years. But it's good to go back and kind of revisit and see what you need.
I really love this idea, and I'm glad that you brought it up, because it's something that every single one of us can pay attention to. As far as, people will sometimes say to me, well, I don't want to take vitamins every day for the rest of my life. It's like, fair enough, right? Yeah. And you can take breaks from it, but you will start to see, like, or I don't want to not eat wheat forever, right? Just for an example. And so as you get healthier and healthier and healthier, and as you start to pay more attention to your body, you'll be able to recognize when your health starts to shift and when it starts to slip. And then you know that you can do something like a couple hyperbarics and an IV, and then, like get in the saunas or do a detox or something to get your health back on track. I do that with juicing, right? Like if I start to feel a little bit like, I don't juice every day. Who has the time? Right.
Right. For real.
Right. But I will do it if I start to feel a little bit off. I'll be like, okay, I'll do a couple of days of this and get myself back on track. Or, just that sort of thing is such an important piece of living well, because if you pay attention to your body and actually listen to it, it'll tell you when you need to do therapies.
Right. Exactly. I just had that conversation with my son.
Did you really?
Yeah, he was like, I don't want to take probiotics. I don't want to take them every day for the rest of my life. I was like, well, you can take them now while you're a little kid, or you can be a grown up and have your gut wrecked and take a lot more.
Right.
And he was like, oh, I'll take these now.
Yeah, it's a good plan.
Good.
Right? Yeah. And so there's some things, plus you can just avoid glyphosate and antibiotics for the rest of your life.
Exactly.
Right? And eat completely macrobiotically, and then you wouldn't have to take it.
Exactly.
But that's just not an option for
everybody.
Anybody. Right. Someday I'm gonna have someone on here that'll be like, oh yes, like I massage my cows that are grass-fed organic, like I do it every day, and then I make sure they slaughter them happily in a ceremony, and then like
it all works out perfect. That doesn't exist.
And I'm gonna live to 3,000. So we only have a couple of minutes left. And so is there anything that we didn't really touch on that you feel is important?
Gosh, it's so good for neurological stuff. Yeah. If anybody out there later is diagnosed with something like MS or something neurological, or there's a mystery neurological illness, I would say just give it a try and do as much as you can. Also, you don't see it working immediately. It takes a little bit to kind of get it going. So give yourself a little bit of time, and also take stock before you start it. And be really specific and really honest with yourself. How much pain do I have? How much, this, that, and the other is going on?
I think that's good for everything, right? Like every therapy you're
really
going to
for
do.
Any therapy. Because one thing that we see, and I'm not a doctor, but I see a lot of patients in the clinic, and I'm sure you've seen this. People forget how sick they felt because it's so it's so bad, and two, it happens so slowly that you get better.
Calibrate very quickly.
Yep, exactly.
We take our existence for granted where we are.
Right. So don't do 3 treatments and think it's not working, because it's absolutely doing something. It's impossible for you to get in there and have nothing at all happen, albeit it might be at a cellular level, but how much of that are you going to feel immediately, especially if you're moderately healthy? That's the other thing. If you're moderately healthy, you don't have a bunch of weird stuff going on. It may take longer for you to really realize how much it's benefiting you.
What about home units?
Yeah, I'm all about that. I think that's really helpful. That's a big thing with kids, parents that have children who are on the spectrum.
We didn't even talk about
that. I guess that's a huge thing that can be enormously helpful.
Right.
And I think home units are great, but I think it's important also to keep an eye on what you're doing and how much. Like I said, for infectious stuff, we use it as a pulse therapy.
Yeah. So I was really happy to have you on today.
Oh, I'm so glad you asked me.
I did learn a lot, because I know that Dr. Anderson has been doing this for a lot of years, and he's got a lot of experience in it, and I always like to listen to things that he has to say.
Yes.
Unfortunately, he wasn't able to join us today because he's doing 50,000 other things.
Yes, maybe next time.
Maybe next next time.
The three of us. That'd be great.
That would be good, with martinis maybe.
Yes.
And then we'll HBOT after.
And then we'll HBOT right after.
So like ketogenic diet goes well with it. I also recommend Cover 3.
Yes.
And you can find it at cover3 allspelledout.com, because it's it's got the 3 core big things that are helpful for neuroprotectant and neurodegenerative issues. They're in little packets, so you can take it while you're in there. Oh, it's great.
Yep.
It's good for It's awesome. So that's a good thing. And then the IV therapies, it would be best, I think, to see someone that knows what they're doing at first, rather than just running off and getting them at a spa, because there's a difference between recreational use and therapeutic use.
Yes.
So you can find Amy at advancedmedicaltherapies.com, stationed out of Seattle. And that's Dr. Anderson's clinic.
Yes.
And then if you have more questions, you can submit them there or to naturopathicmd.com. Thank you for tuning in, and we'll see you next week, Friday at 2 p.m. for the Bad Girls Guide to Living Well. What are we going to do for the rest of the day?
Don't we have to go back?
I think we got to go
back to class
some more. We have to go back to
it's
class.
It's a really good. I'm very impressed.
It is. So we learned today that glyphosate can get substituted into proteins instead of glycine.
Yes.
And then you can have these reservoirs of this terrible toxic shit in your body.
Yep.
Which HBOT could probably help get out.
To get it out. So your collagen, if you guys are drinking collagen, make sure it's grass-fed.
Oh my God, organic. Because otherwise, like all these protein powders and bone broths and things, if they're not organic and grass-fed, then they have glyphosate in them. Same thing.
And then it gets into your collagen and connective tissue.
Yep. And then collagen and connective tissue is important for your immune system. It keeps, we got to go. That's it. Thank you
Thanks, guys. Thanks for having me.
You've been listening to the Bad Girls Guide to Living Well. Join Dr. Heather and her special guests every Friday at 2 p.m. For more information, go to www.naturopathicmd.com.